Well, I'm absolutely delighted today. My guest is Dr. Ashley Wee, and we are talking about the connection between mind and body. Ashley is a doctor of chiropractic, so I'm very excited to have her here to really talk about how the connection with what shows up in the body might have something to do with what's happening in our minds and even in our emotions. Welcome to the Element Q podcast. I'm your host, TJ Woodward, and I'm thrilled to have you join us for this empowering journey. Each week, we shine a light on the authors, thought leaders, therapists, coaches, and healers of all types who are making a difference in the LGBTQ plus community. Together, we honor those who came before us, the courageous and resilient trailblazers who stood for our rights and recognition. Their strength laid the foundation we stand on today. Here, we celebrate their legacy by diving into the stories, insights, and tools that inspire gentleness, healing, and transformation. So get ready to be uplifted and empowered. This is the Element Q podcast. So Ashley, welcome to the show.
Hi, thank you, TJ. So happy to be here.
I'm so happy to see you. We realized it's been almost a decade since we've seen one another. The last time we saw each other, you were at my wedding, which I'm so grateful for, with your
Yes.
wonderful partner, Melissa, who I also love, and we've had as a guest on the show. So I'm curious if we can just dive right in because I love the conversation of this connection between mind, body, emotion, body, even spirit and body. And it often shows up in your practice first physically. So I'd love to hear more about that.
Yeah, let's do it. So in the past 8, 9 years of practice or so, I've been in different models of care. But the mass majority of the time has been in a multidisciplinary primary medical center. Primarily with patients that are dealing with multifaceted issues from like behavioral stuff to socioeconomic resource access to care, things like that. So usually when they get referred to me, it is a physical ailment. But quickly as we start to talk about what's happened to them in the past, and they're like, I don't really know how this pain started, it comes out more that there was some kind of emotional trauma or other distress that did trigger it, actually.
Yeah, and I'm curious how you get to that, right? Because someone's presenting, with this something happening in their body. And as we often know, or as we know often, what ends up happening in the Western medical model is we look only at the symptom and how do we eradicate it. And there's a place for that, but we are evolving rapidly in all things medical, where we're beginning to understand more and more about this connection and that it's not just one thing and it's not always just about getting rid of the symptom. So how do you work with someone, maybe they're not able to connect the dots? How do you help them with that process?
Yeah, I mean, some patients do come in with that connection and they'll say without realizing the connection of saying, yeah, I don't know, I just have had these headaches since I was a teenager. And I'll ask, what are triggers that you've noticed or patterns that you notice? And they'll say, well, my neck gets really tight. And I guess I always hold my stress in my shoulders, or my headaches always start after I visit my parents, or something like that. And so I'm like, oh, that's really interesting. And I just bring curiosity to that conversation. And if they feel safe or comfortable sharing more, then we'll dive into like, okay, like, what do you notice when you're stressed out? And how does that present in your body? And it comes out that we notice like a breathing pattern difference, or like clenching their jaw, or their sleep quality is poor. And all those things can manifest into physical symptoms. And so when it's something that is physical, then I'll address that, right? If it's like a muscular tension problem, if there's some kind of other structural issue. And then once it starts to creep that scope of, oh, like this sounds like this is like a common cycle for you of some kind of stress, anxiety, or if they share with me that they have depression or something like that, I ask them if they have support. And if they don't, then I'll loop in someone in the mental health field to come in and be another team member on their clinical care team, basically, and help them not just address whatever the mental health concern might be, but also how chronic pain can have its own like need, essentially, from therapy.
It's interesting because on the opposite end of things, I've, worked in behavioral health now for almost 2 decades. And a lot of times the physical isn't looked at in the mental health world, right? So working in behavioral health in addiction treatment programs and mental health treatment programs, a lot of times people will show up and they might have some things happening physically that get overlooked because I think traditionally the medical field has been somewhat siloed. Like, oh, go to this specialist for, therapy, for physical therapy here, go if you
Mhm.
have this diagnosis over here, right? So, truly integrative care is where we're headed, and it's a really wonderful thing to see. And one of the things I love about Element Q Healing Center, which I'm honored to be a part of, obviously that this podcast is dedicated to that, and then Monema Behavioral Health, we really do look at the physical, intellectual, emotional, and spiritual, and not just saying, okay, we look at these, but truly care for all four of those, what I call the rooms, right? The four different
Mhm.
rooms, because they're all connected, right? They're actually not siloed. My physical symptom may have something to do with the past trauma or something happening with my mental health or well-being, and vice versa. So for anyone watching or listening right now, I'm curious if you have anything that you would offer either the clinician or the person that might be experiencing these multiple layers of symptoms, or maybe sometimes it's like something just feels off and I'm not quite sure what it is.
Yeah, there's a really interesting push in, I think, both mental health and in physical health now of pain science.
Yeah.
And you may be familiar with this, TJ, that there is neuropathic pain, so pain that is more structurally associated, and then neuroplastic pain, or what we call primary pain. And how someone like a listener may maybe relate to this is if the pain came on and nothing specific really happened. Like there wasn't like a car accident necessarily or a fall or some kind of clear mechanism, but this pain happens and then sometimes it just goes away or sometimes it like flares up randomly and you're like, was it the weather? Was it my stress? I don't really know. And sometimes it's multiple areas where it jumps. Maybe sometimes it starts in the neck and then it goes to the shoulder and then it goes to both hands. And there's this unexplained thing where maybe you've gone to your primary doctor, they referred you to physical therapy, occupational therapy, chiropractic, pain management, orthopedics, neuro. The tests are coming back negative, right? Your x-ray's clear, your diagnostic studies aren't showing any kind of like nerve issue, but you're feeling nerve pain. And so for a clinician and or for a client to notice like there is some kind of missing component here, there's a possibility that there may be a neuroplastic pain associated with what's going on, which can be dealt with people that are trained in like pain reprocessing therapy, for example, or somatic experiencing therapy. Um, and I think for people in my field of physical rehab, when we start to recognize those things, instead of just saying, "Oh, our modality didn't work for you, let's just send you to pain management," let's actually take a look at the mental health side and see if there is some kind of component that's exacerbating the symptoms.
Yeah, because as we know, it is all connected. It's not siloed, even though the medical field has been somewhat siloed, even that is becoming
Mhm.
more integrated. And I'm so grateful. Even in my work, back in the day, addiction and mental health weren't even in the same category, if you will. They weren't even, you go down the hall to mental health or go down the hall to addiction, right? And even that coming together is somewhat new in the past like 20 years or so in behavioral.
Yeah,
I'm wondering if we can switch gears a little bit and talk about like your personal journey. I'm always willing to talk about mine, but what drew you to
sure.
this work? What's the connection from you and your own history? Because I know for myself, working in behavioral health, about 100% of the time, we have something in our history or something in our
Yeah.
story that draws us to this work.
Yeah, so my mom worked in a hospital my whole life, and so I always had some draw to healthcare in general. I was a athlete back in the day, and so I had my share of injuries at that time. So it drew me to physical therapy originally. I started working in PT clinics as a aide straight out of high school. I got my personal training certification at that time too, so I was really interested in just helping people move and move well. And in that journey, I got diverted to psychology for a short period of time. So I ended up getting my bachelor's in psychology. I did research in health psychology. I was mentored under a professor that did a lot with motivational interviewing. And so I did a quick detour in health coaching using motivational interviewing for about 7 years. And after doing that work, I got pulled back into physical health again. I had a coccyx dislocation, or my tailbone got dislocated during a snowboarding injury. And so my friend was like, you should check out chiropractic. Like, you should look into it. Like, they can do really amazing work. And I was like, I don't know. I was kind of skeptical. But I went to someone who really helped me and got rid of my 10-month long sitting pain within a couple of visits. And I was like, what is this like magician work? And so, yeah, so then I got my master's in exercise science, and then I went on to get my doctorate in chiropractic. And so now that's where I'm at now, just kind of trying to marry the two.
It's so interesting. I love that. I love that you had that journey because that's so useful. I know in your practice now when we're looking at really truly holistic care. And I will always do a shout out to chiropractor, to chiropractic, because there were a couple of times in my life where it really shifted things for me. And for myself, I realized that there was a connection with some of the things that were happening, what we would call behaviorally, but really much deeper, like sort of some of these unhealed wounds within myself. And that's kind of what I want to lean into right now. You know, the focus of this particular podcast is the LGBTQ plus community. We see a lot of wounding in this community, understandable wounding for a lot of different reasons. And I'm wondering when we think about how we do move into deeper healing, whether that's again the four rooms, physical, intellectual, emotional, and spiritual. I wonder if there's anything that shows up for you that would be interesting to highlight or just talk about either in your personal experience or in your practice. Because for me, working with people in this community, you know, in my model conscious recovery, I identify the root causes of addiction as unresolved trauma, spiritual disconnection, and toxic shame. And
Mhm.
really within our community, it's almost a given that we're going to have all three of those, right? And I know
Yeah.
times are changing, but for most of us, we've experienced a lot of all of those.
hmm Yeah, I think that there's a lot of micro traumas, if you want to call that, within the medical system, where even if we go through our diversity trainings as healthcare practitioners and they do their best to try to be, I would say, more accommodating and like less dismissive of the LGBTQ community, it still happens. And so for patients or potential patients out there, like I think it's okay to be choosy about who you see for care. Um, and trust your gut if this clinician feels safe to you or not, even though you're going to someone as like a deemed expert. Um, I find that a lot of patients will come to me and sometimes they're kind of timid about being forthcoming of what has happened to them in the past. And as they do have this feeling of safety that I am a safe space for them to share, then more does end up coming out that we can make that mind body connection. And then I try to refer them to people that they would also feel safe with, but just to have that agency in your care that I think not every practitioner is going to be well trained in pain science and also understanding that connection. And they might go through your diagnostic results and it might sound really scary, where they make you sound damaged. And I think that that's not necessarily going to be empowering for you to go into that path of healing, right? So I think that would be my like 2 cents, I guess, specifically is just to listen to your intuition, find people that you feel safe with, and don't proceed if you don't feel comfortable.
Oh, I love that. And, you know, we talk so much about holding space and safe space. And in some ways, those terms have been a little hijacked in sort of pop culture with safe space. Safe space, I think at some point in our culture became a place where we all agree with one another. But we're talking about something really different here, like true
Yeah.
safety from a practitioner to a client or a patient, where we're really honoring someone's experience. I know I'm thinking back, you know, just going to doctors early in my life and just they were always the one with the answer, right? And here's what's happening with you. And sometimes I'd be like, that doesn't intuitively feel right. And back in
Mhm.
the day, it was just sort of this like top-down model of like, no, I'm the doctor, I'm the one with the experts, and I'm the one that is the expert or who is the expert. And when I think about that model and how it's shifting, because there's so much information, and I think about it through the lens of trauma. And I use this quote all the time that Bessel van der Kolk says, trauma doesn't show up as a memory, it shows up as a reaction. And sometimes that reaction is something happening physical in the body. It doesn't mean it's always, and I appreciate that you really spent some time talking about, you know, it could be that's a secondary pain, or it could be that's the primary issue, but they are
Mhm.
definitely connected.
Yeah, definitely. I think it's also kind of a misnomer when people hear the whole neuroplastic pain thing of like, so are you saying it's just all in my head? And it's not, right? Like TJ, you know that there's certain nerve like, or brain pathways that get lit up with trauma, and they get lit up also with physical pain, and sometimes they're the same regions of the brain. And if your brain is perceiving it as pain, it is real. And so there's this thing where if someone is going through neuroplastic pain, practitioners have opportunity to not be dismissive of the person's experience in that case, and say your pain is very much real, but the treatment plan is going to be different because of where we think this pain is coming from, as opposed to saying like, oh yeah, like your wrist is fine, like there's no issue there, like you're just stressed out, and being really careful with our language in that case of, like you said, honoring the person's experience.
Yeah, and we also all have different thresholds to pain, right? That's like when we adopted that 1 through 10, I always say to someone like, "What's your pain level 1 through 10?" I'm like, I don't even know how I can possibly answer that because like I have this, I think, really high threshold to pain. Like I fell off a ladder down the stairs, shattered my heel in like 8 places, and my
Oh my
solution was,
God.
let's go have dinner. I'm fine. I'm always fine, right? That's kind of my strategy, and it's interesting. It's my strategy that has served me well, but it has also not served me well sometimes where like I go into my defaults of like I'm okay and fierce
Hmm.
independence. And I ended up going to dinner and my friend who was is a nurse practitioner is like, you need to go to the ER. You're not okay. You can't put your foot on the ground, right? And this was many, many
Yeah.
years ago, but it was an indicator to me that like that 1 through 10, because I would have told you my pain was a 5, but when we did the x-rays, they were like, this heel is shattered in like 8 places. Like this is a big thing. How could you
Yeah.
possibly have just walked away? So
Yeah.
what do you have to say about that too? I think that's interesting. And part of it for me too is like that I know that that's a trauma response for me because of my
Hmm.
own emotional trauma that happened as a child. My strategy was always, I'm fine, I'm good, I've got this, I don't need anyone,
Hmm.
like that wall.
Hmm. Hmm. Yeah, it's very interesting. I was running through my mind as you were telling your story. I'm like, I wonder if this is appropriate for me to say because I'm not a mental health clinician, but I'm married to one.
Right.
And so I hear a lot of language in the background of like trauma response, right? Of like having to put your needs secondary. And so that in cases when you should be prioritizing yourself, you don't. And so the brain is amazingly powerful. You can convince yourself of anything. And so, yeah, your leg could be swollen and broken, and you're like, let's just go to dinner. We're gonna be late for a reservation. Is like kind of incredible to the power of your brain. But yeah, I mean, a lot of pain science now too says to not quantify pain in that way. Old school chiro PT is like first thing when you come in, what's your pain level today? 0 to 10. 10's go to the hospital. 0 is nothing at all. And my experience at this mental or medical clinic has been that a lot of people will say 10 out of 10 or 12 out of 10 because they've been dismissed in the past, and then they don't want people to perceive that their pain is not needing care. And so I will sometimes ask them to quantify, just get a baseline, but then I tell them that this is your number and it is going to be different for everybody. And so we just want to look for patterns, basically. Is that number decreasing over time or not? But we're not going to put too much power in that number because we don't want to put too much emphasis on just the pain. We want to focus too on like how do you heal in other ways in your function, in your day to day? Can you do more things? Um, and I'm sorry, I kind of lost my train of thought, but we were talking about, you said
Just the idea about this
trauma.
scale of pain, right? And we all have a
Oh
different
yeah.
threshold of pain, but also like
Yeah.
different strategies to manage trauma, right? It might
Yes.
not just be trauma. We might just have a strategy to manage life. And a lot of times, if we're looking at the psychology of it, which of course is the world I live in,
Sure.
those are like early adaptive strategies that become the unconscious way of being in the world until we start to look. And I can see the parallel with that quite possibly with
Hmm.
physical pain as well.
Yeah, definitely. Yeah, they've done some interesting studies to just show the power of how your brain perceives pain. And so there was I want to say it was in Germany, but they did a study where they prompted the Apple or the participants that they were going to put this headset on everybody and it was going to reproduce a headache.
Mm.
And so the actual headset wasn't attached to anything. I don't know if you've heard this study before.
Yeah, it's fascinating.
But yeah, so they just put the headsets on. They're like, you might experience something. I think they maybe did some kind of acoustic thing, like a sound thing, but there was no actual any kind of electrical impulse or anything into the headsets. But 50% of the people left saying they had a headache. And then a month later, they did a follow-up, and a certain percentage still had a headache, but there was actual no like intervention that was done to really create that. So it's really interesting how our brain in anticipation of something awful happening to us or the fear of like some kind of damage happening, we can manifest it. And so that can definitely happen from other types of trauma too. So
Yeah. I'm curious if we can kind of switch gears and talk about the work that you are doing with your wife, Melissa, because you recently presented at our program, and I want to hear a little bit more about like you're doing some work together, right? You're bringing that together, and I'm curious to hear more about that.
it's a project for the future, but it's in the works. So we're kind of in the brainstorm phases still, where she's been going through her somatic experiencing training and changing a little bit of how she approaches her therapies. And I've done extra training as pain reprocessing therapy because I just noticed the limitations of when we only address things from a structural standpoint. So we're trying to figure out what would be the best way to have a network of clinicians that are like-minded that can all be this I guess well-informed place for people to go to be able to address both things, because I think that it's hard when someone's in a different system and then they are told a different messaging, and then you try to undo some of that in your sessions, and so there's a little bit of like competing theories on like what's going on, and so to have a group of clinicians that can all have the same messaging and have the same support and they're trauma informed could be a really great like healing space in the future.
I love that because a lot of times too, just to be slightly snarky, sometimes we have to unlearn some of the things we learned in school, right? Because we get taught certain paradigms and some of them may still ring true for us, but then we have awarenesses in actually working with people. It's like, oh, there's much more here. There's much more than what I was taught, or now we know more, or now I'm exploring more, or my own experience is showing me something different. So I love
Mhm.
the concept of unlearning. We could do an entire 30-minute talk on what there is to unlearn. I
Yes.
have been loving this conversation. We're actually coming to the end. In a moment, I'll ask you if there's anything else you want to bring up that we haven't. But I was just thinking about, again, kind of to reiterate this idea that we've been so siloed in the way we look at a person. Like, I don't have parts. All these parts are together, right? There is the physical, intellectual, emotional, and spiritual. And to me, anything that's showing up, whether that's a mental health concern, an addiction, something showing up in our body, all of that, really doing that full integrative care and treating someone from this whole person perspective. It's surprising to me that it's new.
Right.
It's not really new because there are ancient practices that have been doing this for a long time. So I want to be clear
Yes.
about that too, right?
Right, right.
Particular in China with, acupuncture. I mean, I was the sickest I've ever been coming. I came back from India. This is long, long time ago in the 90s. And I was so sick I couldn't even like keep track of time. And my friend is like, I'm going to take you to a doctor. And I show up at an acupuncturist and I will promise you I had an eye roll because I was like, no, I need a doctor. I was
Yeah.
better the next morning, completely better. And I was like, oh, there is something to all this. And as a matter of fact, it was one of the things that shifted my trajectory of how I started looking at health in general.
Yeah, I do think that things are catching up, to some of the Eastern philosophies of medicine. You'll see more rheumatologists and other primary doctors who are taking into account like your gut health and how that manifests also and some other physical symptoms and even your mental well-being based on like what you're putting into your body. And um, so yeah, I'm hopeful, that the trend keeps getting pushed forward. It becomes more commonplace, and it's not such a novel thing to have people want to collaborate together cohesively and be supportive of like everyone is bringing something different to the table.
Yeah. So, any closing thoughts or anything that we haven't talked about that you wanted to bring into the conversation before we close?
Yeah, I mean, I guess I just want to just point out that if you've had pain for a long time, that it doesn't mean that you've necessarily exhausted every possible intervention out there. If you've never tried some kind of combination of having your mental health practitioner speak with your physical health provider and having a more like collaborative discussion on like your care, that is an opportunity that may have been missed. And so to explore that.
Okay, beautiful. Well, thank you, Dr. Ashley Wee, for being on the show. We'll have your full bio in the show notes along with your contact information so people can check out your website. I just want to thank you so much. It's so wonderful seeing you again. It's been almost 10 years. So I
I know.
really appreciate you. Thank you. And everyone who's watching or listening, if you've loved this show, this episode, please like, please share. Please share it with someone who you think it will help. So peace and blessings, everyone. Thank you. And thank you again, Ashley, for
All right,
being.
bye. Thank you, TJ.
Thank you for joining us for this episode of the Element Q podcast. It's an honor to walk this path of healing and transformation with you. Remember, the courage and resilience of those who came before us live on in each of us. Let's continue to carry their legacy forward as we support one another in creating a world filled with love, gentleness, and empowerment. If you enjoyed today's conversation, please subscribe, leave a review, and share this podcast with someone who needs to hear it. Together, we're building a brighter future, one story at a time. Until next time, I'm TJ Woodward, and this has been the Element Q podcast.